PACSES, Bridging the Gap in Healthcare Division in Pakistan. 64% of the total population of over 200 million people live in remote areas, with a single rural health center for every 184,000 people. Difficult terrain and distance from specialist care services result in a lack of adequate care for a majority of the population. PACSES aims to increase accessibility of healthcare for all in the population. By utilizing telemedicine, healthcare can be delivered to underserved places and people. How do we aim to achieve this? Take Reema, a 19-year-old girl living in rural Bayalkot, Pakistan, for example, who is suffering from painful and irregular periods. The pain is constantly getting worse, which worries her. Reema uses a phone to dial the nearest remote access point, which sends out field workers to the location, by motor or by foot if the area is inaccessible. Before the field worker leaves to reach Reema, the field worker notifies on-call doctors at the medical center of the appointment. Once the field worker reaches Reema and performs basic observations, a video-audio link will be established with the doctor in the medical center. This gives the doctor the possibility to interview Reema directly if required. Based on the interview, the doctor will be able to make the diagnosis and suggest possible treatment options. The remote access center will distribute the necessary medications accordingly. In the case of Reema, she requires further diagnostics and is referred to a specialist unit in a nearby city. What makes our project special? The use and training of our local field workers, thus providing the community with employment opportunities and removing hardships associated with transport by bringing specialist care directly to the homes of patients, bridging the gap between rural and urban healthcare access.